you, Dr. Maha. Dr. Maha, please, are my slides visible?
Yeah, visible.
Okay, thank you. Dr. Silva, nice meeting you and sharing the same platform with you. As a senior colleague, I bow to you for this wonderful presentation. I myself have also learned a lot from your slides. God bless you all. Victory Namake, Victory Nicham. So ladies and gentlemen, my name is Dr. Nathaniel Ofori. I'm a medical doctor from Ghana, and it's been a warm, pleasing pleasure as well as a privilege connecting with you all globally through the power of technology called Zoom. It's our second health symposium. And just as Dr. Silva has talked extensively about immunity, I'm now going to correlate all that he said together with what our product can also do to help us all. Most of my research work was done by these doctors who lived in the 90s. We have Dr. Jules Hoffman, Dr. Bruce Bowler, and Dr. Ralph Stanley in 1973. And they were able to study significantly how our immunity plays a role in our survival. And so in 2011, they were given a Nobel Peace Prize for their research they have done. And all that they are saying is that our body, if it doesn't have immunity, we are going to have illnesses, because as a human being, you are exposed to toxins daily. So we have two groups of immunity that the body is going to undertake. The first is innate, and the innate means that it is outside. It is the first barrier to infection. So we have most of it covered by the skin and mucous membrane. When whatever pathogen or virus or bacteria traverses the first barrier, then the adaptive also comes in. So the adaptive immunity basically happens when the thing enters the bloodstream and it is in circulation. So the adaptive immunity now comes to pick it up. I want to just do a casual view of what Dr. Silva was doing so that you picture what it is that he was trying to say with pictorial evidences. So if we talk about the innate immunity, whereby the skin plays a major role, the skin has a barrier called epithelial layer. If a virus or bacteria or any foreign body attaches it, we have natural killer cells and complement cells that goes to attack it and kill it. On the natural killer cells, it has its arsenal. We call it CD cells. So we have CD6, CD2, CD6, and CD65, and that is what it uses to kill these bacteria, viruses. Now, if the bacteria start to duplicate and it outnumber the immune cells, then it enters the bloodstream. As soon as it enters the bloodstream, the blood also have B cells, B lymphocytes, T lymphocytes, and antibodies that also go into kill all these foreign pathogens. So let's look at the innate immunity, where the skin plays a major role. We have the outermost layer of the skin called the epidermis, which is in stratifications. I'm not going to mention any scientific name to confuse you, but the outermost layer is the epidermis and the innermost layer is the dermis. So the dermoepidermal layer, the junction, that is where stem cells are produced gradually. So it produces as one, then divides and then starts to proliferate. And as we age, it loses its function. This is an electron microscope that was used to capture what is happening in the body. So we have neutrophils, which are body's arsenal or immunity that is resting because there's no infection happening. But as soon as any infection enters the bloodstream, they are activated. So you see an activated form of the same neutrophils that were resting. Again, this is an electron microscope, but this one, they did a color electron microscope. So we have a bacteria called Shigella. This is one of the main causes of diarrhea associated with food poisoning. As soon as it enters the body and it is in circulation, the immune cells now try to engulf it into itself and start to release certain chemical component called lysosomes, which kills the bacteria and then makes sure it is neutralized. And that is what the body's defense does. Where do we get some of these immune cells from? Majority of it is coming from the bone marrow, which produces the B lymphocyte and the T lymphocyte. But the T lymphocyte don't get matured in the bone marrow. It gets matured in a thymus. The thymus is an organ that is just above the heart and posterior or behind the sternum. The sternum is the bone which is closer to our chest, where the ribs comes to engage and interlock. If you look at the thymus, it contains cells we call the thymocytes, and they contains numerous forms of immunity. So all these small cells you are seeing are immune cells within the thymus. But there's a problem. If you are young and you are born, the thymus is hugely enlarged. As you are aging, nearing puberty, it still gets enlarged, but when you hit age 30, it begins to atrophy or begin to shrink. So you see that the thymus starts to increase in size as you are nearing puberty. When you hit age 20, getting to 30, it starts to decline. What that means is that the function, the number gets reduced significantly. That is why aging population are associated with low immunity. And this is pictorial view of what we are telling you. Again, in the 17th century, a Swiss doctor by name Johann Peyer identified that within our intestine, we have something that contains immune cells. So it was named after this Swiss doctor called Johann Peyer. So this thing you are seeing in the intestine, we call it Peyer's patches. So we have it at the jejunum, which is part of the small intestine, and then also the ileum. What it contains when you take an electron microscope is that it contains microfold cells, and these cells, if you do the biochemical analysis of it, contains a lot of immune cells that make sure any infection that gets into the stomach are battled with. So now, let's look at these two individuals. They are well known in the world of football. We have Diego Armando Maradona and Pele. When they were young, they were at their prime playing football. But 50 years, 40 years later, we have Diego Armando Maradona gaining more weight, getting a very big pot belly. And then this is Pele. What happened between these two individuals? It all has to do with lifestyle choices. And that's what Dr. Silva emphasized. In their young age, they were very, very slim. But in their adult age, something happened drastically. So now what Dr. Silva was talking to you about our lifestyle, lack of activity, poor nutrition, fast food, alcohol, exposure to toxins, UV radiation, smoking. These are the things that everybody is going to suffer and is going to reduce our immunity drastically. So if you take a normal cell like this cell in a sterile environment, when it has not been having exposure to any toxins, its cell membrane is intact. The cell membrane is very, very, very intact. But as it gets exposed to toxins, it undergoes oxidative stress. And so the integrity of the cell membrane is even hampered, and it's because of free radicals as a result of the body's process of fighting all these illnesses. So it was for that reason that in 2015, the World Health Organization came together to change the Millennium Development Goals and now named it Sustainable Development Goals. And one of the Sustainable Development Goals is good health and wellness, because if they're able to tackle this thing, that is where the world is going to improve. Without health, you do not have a very stable economy. There are about 17 of them, and number 3 is basically going to talk about our good health and well-being, and that's what Dr. Fred Zuli, the man who produces most of our products in Zurich, did. His factory has a lot of history because they started in 1991. And this is another doctor he recruited early part of his organization. He's called Dr. Daniel Smith. He's the head of research in Mibel Biochemistry, and they do extensive research on the active ingredients of whatever product Mibel Biochemistry have been doing, and that is why the company has been winning Innovative Prize Award consistently since 2017 when Superlife partnered with our company. The office is in Zurich where they produced our products. Currently, we are having a manufacturing plant in Malaysia where our products can also be manufactured globally and distributed. So now we are going to show you a scientifically tested and proven product that is in the market that do help everybody. Before now, we had only 3 products in the market: Superlife Total Care 30, Superlife Colon Care 15, and Superlife Immune Care. but on the 22nd of June, we launched a second product. The technology we are using is called phytocell tech, and it's a nanotechnology whereby we take the cells of plants and extract its active ingredients and make multiple uses of that. This technology was launched at Rio de Janeiro in 2012. 2 years down the line, it won its first international award, which is the Sustainable Award in Cosmetics, because this technology, the phytocell tech, was now being used in the cosmetic industry before they started the nutraceutical portion of middle biochemistry products. How are our products manufactured? What they do is that they are able to take active ingredients from all plants that they deem fit to boost the immunity of human beings. When the active ingredients are extracted, they put it in an agar, and the agar helps the active ingredient to now grow. Then they will put it in a photobioreceptor, and that proliferates it into multiple molecules, and they are made into powdery, which is marketed globally. Now, STC30, our flagship product, contains an apple stem cell, which is a switch apple named Malus domestica. It helps regenerate new cells in the skin. Its activity is enormous, particularly for people with it helps with anti-aging property. Many people that take our products tend to have to regenerate new cells that make them look very, very young. The anti-aging property in the Swiss apple Malus domestica is really, really incredible. Grapes also have antioxidant property and anti-inflammatory property that mops up toxins that are in the cell, and individuals with lots of pain due to free radical deposition in the joints are held because of our grape stem cell active ingredient. Now, bilberry does 4 main properties. The first is that it protects the liver. The second is that it also protects the kidney. The third, it also protects the blood vessel. The blood vessel has 3 main structure. We call it tunica intima, tunica adventitia, and tunica media. When you are aging, it begins to dry up, and so you get a condition called atherosclerosis, and that is associated with so many heart conditions. The bilberry component maintains the integrity of our blood vessels so that blood flow from the heart to the liver, from the heart to the kidneys are maintained at optimal level that do not lead to liver problem or kidney problem. Glycoside gantalupe and glycoside gliadin contain the SOD, superoxide dismutase, which is a powerful antioxidant that does more of the mopping up of toxins in our system. And my favorite is the blackcurrant extract because it contains a pigment called anthocyanin, which is very rich in gamma-linolenic acid that protects our heart. And this product has proven to be very helpful. My research work done on it indicates that it is able to activate AMPK, which is a protein that is receptive to insulin. So people who have diabetes, when they take the product, because of the blackcurrant anthocyanin in it, it is able to activate the proteins on the pancreas, AMPK. And so it's able to mop up a lot of sugar from the blood, and blood levels start reducing. This does not necessarily mean that you have to stop taking your anti-diabetic medication. Just as Dr. Silva was saying, the body needs to be modulated. And so a doctor is the one supposed to help stop anti-diabetic products. By the cells doing all these things, it's helped with macular degeneration, spinal cord injury, stroke, cancer, infertility, all because it is freeing the integrity of the cell membrane. The way the product is taken is a powdery supplement which is poured under the tongue. We have some sublingual glands there that make sure saliva comes at the floor of the tongue to take all the active ingredients into the sublingual arteries. That takes it to the external carotid artery and then the big common carotid, and then it gets into circulation. So bioavailability is very, very intact. The active ingredient that was made to make STC30 do not function in an acidic medium. So if you pour it on the tongue and it enters the stomach, because of the acidity, it goes through a process we call first pass effect, where it is metabolized before it gets to the target organ. So bioavailability is drastically reduced. So for STC30, it is recommended that you pour it under the tongue for bioavailability to be optimum. One sachet is equal to 1,500 milligram, and that is equivalent to about taking 85 pieces of banana that contains a lot of vitamin B6, 22 kilograms of spinach that contain a lot of vitamin E, 44 large eggs that contain a lot of vitamin D, and about 19 pieces of oranges that also help boost the immune system. And that is what you are taking when you take a sachet a day. The way it is taken, you take it on an empty stomach, pour it under the tongue early in the morning. And if the person do not suffer from kidney problem, he can take between 200 and 300 ml of water after it is dissolved. But if the person has a kidney problem, it is advised not to be taking water alongside, because fluid overload is not good for the kidney. On the 22nd of June, we launched our new products, and I think a lot of people will benefit if I delve into SNC first before the others. Now, SNC stands for Superlife Neuron Care. This product marginally help people with brain problem, eye problem, and then heart problem. How does that do that? It contains active ingredients called lutein and zeaxanthin. These are pigments that gives color to plants. So you see the color orange here is because of the lutein and zeaxanthin. They have the same chemical composition. The only difference is that where their double bonds are located makes it different. That's why their names are different. So we have lutein and zeaxanthin. One of the things it does is that it helps keep the integrity of the macular cells in the eye. So people that are aging get age-related macular degeneration that results in blurred vision. But people that take SNC, it is going to reduce the senescence or aging that is related to the degeneration of the macula, and so their eye integrity is going to be maintained. We have jingo biloba extract, and this product is very, very powerful. Studies indicate it increases nitric oxide by 12% in an aging patient, and so the nitric oxide extends the blood vessel for flow of blood to get circulated to all organs. And it also contains powerful antioxidants that mops up toxins, particularly in the brain. So people that suffer from Alzheimer's and dementia because of free radicals contributing factor are relieved on taking SNC. DHA is an acronym for docosahexaenoic acid, and it's an omega-3 fatty acid that helps reduce a lot of cholesterol in the vessels. And so people taking SNC are going to have a lot of cardio improvements. Now, Concord grape is my favorite among all these active ingredients we find in SNC because it contains a powerful molecule called resveratrol. You hear a lot of people saying that red wine is good for the eye. It's because of the resveratrol component in it. And Concord grape contains a lot of resveratrol, which also protects the heart, cardioprotective. Bilberry is very rich in vitamin C and also a very powerful antioxidant. So we've already narrated how antioxidants help because it mops toxins from our body. Now, spearmint keeps the integrity of the stomach very, very well, and it's one of the most powerful products that is also an addition, an addendum to the brain function, eye function, and the heart function that SNC is going to produce. Then we have saffron. You see, many women and men are going to go for SNC, not because of that they have an eye problem, a brain problem, or a heart problem, because the saffron is a natural aphrodisiac. So it is going to increase your libido and also increase your performance in bed. So many married couples are going to have these stressful issues of non-satisfaction in bed addressed by the saffron, which is also it also has anti-carcinogenic property. People who have cancer, they are going to get their problems resolved upon taking a new product that was just launched on the 22nd of June 2020. Now we have SCC15. Now, let me go back to SNC. SNC is taken orally, not sublingually. It is taken orally. So you can pour it on the tank and drink 200 to 300 mils of water, provided you don't have any kidney problem, If you also want, you can pour it in water, shake it very well, and drink it. That is how it is taken. Then we have SCC15, Superlife Colon Care. The active ingredients are enormous, and Dr. Silva mentioned, I showed you the Payer's patches and what it does. And Dr. Silva also mentioned that the body has what we call normal flora. We have organisms in our system that helps with digestion, but they are in ratio of 70-30%. So if you have the good bacterium now diminishing and the bad ones are increasing, it gives you a lot of GIT problem, gastrointestinal system problem. So we have lots of people with inflammatory bowel disease, hemorrhoids, all because of the disproportionate rate of the normal flora within the gut. So by taking these active ingredients, what they do is that they strengthen the microfold cells within the Payer's patches and also build more good normal flora within our system that detoxifies the colon and make it very, very healthy. In summary, this is basically what SCC does. It is very, very good optimum for gastrointestinal organ. Then we have SIC, Superlife Immune Care. These products have been fortified with berry, blackcurrant extract, iron, folic acid, vitamin B6, and magnesium and zinc. So it helps keep the integrity of the neutrophils, eosinophils, and all those components that Dr. Silva was talking about. You see, we have something called immunomodulatory things that is supposed to happen. Natural killer cells must have CD2, CD16, CD18. But if you are compromised because you have hypertension, diabetes, high cholesterol, its expression is reduced. So this product helps express all the immune cells within our body and is working very, very magical. In summary, what we are describing to you that these products help rejuvenate aging cells and fortify it to get a lot of energy. The cells in our body that are in good state, it duplicates it more. The cells in our body that are sick are restored. Those that are dead are replaced, and the damaged ones are repaired. Basically, that is what stem cells, the phytocell tech we are using, does in our body. Our products have insurance liability by MSIG, which is a Japanese company, but we must be very careful because a lot of people now tend to use the word treat, cure, and so when it enters the mind of their client, they tend not to use their orthodox medicine, and they want to use this because they've been promised that others have the testimony, and so they want to use only this. If anything happens, MSIG states that do not give this product to a pregnant woman, a nursing mother, or anybody under medical supervision. Let the person inform the health practitioner that the orthodox medicine, the antihypertensive, antidiabetic, is adding this food supplement so that the doctor is aware. This is a prescription, you don't need this is a product, you don't need a doctor's prescription. Anybody can take it because of the natural ingredient, which is organic, and because of its synergistic effect. And today I learned from Dr. Silva that preferably don't even take it alongside your normal orthodox medicine. If you take this product, wait for about 2 hours before you take your orthodox medicine, or the other way around. Now, many people, because of the money they are going to get, will still go ahead and do whatever they want. If Superlife gets sued, they have a disclaimer insurance liability claim that says that you do not use the word treat or cure, because the product actually does work, but never use the word treat or cure. And this is a disclaimer the company has made. Everybody who is a partner of Superlife and you are registering, there's a checklist you have to check before you continue to confirm your registration, and that is to abide by the code of conduct of our product. Because of the quality of our products, we won the Asian Masterclass Award in Healthcare Supplement Excellence in 2017, the year Superlife was in existence. And then in 2018, the ESQR, European Society for Quality Research, gave Superlife the Quality Choice Prize Award Good category because of what the product is doing in the marketplace. We know the product have high quality and the results are very positive provided you abide by the code of conduct. You have to be on this product for minimum 3 to 6 months, non-negotiable. The fact that someone used the product for 1 week, 2 weeks, 1 month and had a testimony does not necessarily mean that everybody would have the same end result. So I'm going to share with you testimonies, particularly of myself that I have used the product for. When I started practicing as a medical doctor, I started with general surgery and I would stay in theater for so long a time. And I started developing some severe back pain. So when I got to use STC30, which is the only product available in Ghana, it really, really helped me. I poured it under my tongue daily for 1 month and the back pain got resolved. And I met this patient who suffered from a condition called toxic erythematous necrolysis. And this is a condition that people's body are allergic to, even food or drug, particularly if it contains sulfur. Now, this person came to our hospital. The first person I called, because I was a doctor on duty, was a dermatologist, because that is her specialty. And when Dr. Damaris came, I suggested to her that upon the orthodox medicine, the steroids, the oral feeding, and all the nutritional supplements, can we also add a product I think will help the patient? She appended to my request and it became an addendum. Just within 15 days, we found significant recovery. And this is a patient who had suffered drastically upon taking a drug that his body reacted to. And with his permission, I took a picture with him when he was leaving, and we did the follow-up in a month, and this is our patient. So we know that the product really works. Now, I, as a doctor, when I realized that this product actually works, I endorsed it for myself and anybody I wanted to give this to. So how was I going to do this? The first thing I did was to go to people's offices where I was showing them the evidence that I have found, particularly for myself and for my patients. And I have this man called Mr. Osman Safiano, who's the manager of Ghana Water Company, and then Mr. Gosenblebo. Apparently, these people were suffering. Within 3 months, the man came to me when I was having another symposium, and he came to share a testimony because he was looking for a child. It's not that he doesn't have a child, he has a child, but for 5 years, the second child never came. Upon using the product, the wife got pregnant. He used the product together with the wife. In 3 months, the wife got pregnant and delivered a live baby. So we now have a super live baby in my team. The testimony of the wife boosted the morale of Osman, who was also looking for a child. And so Osman too now has his child because his wife too was also looking for a second child. And I don't know what is happening in my team. We now have a third super live baby in my team by an immigration officer I recruited when I was crossing the border from Ghana to Togo. And he wanted to know if I could help him, and he shared with me that he was also looking for a child, and I introduced STC30 to him. 9 months down the line, this man's wife has delivered. And I have a man in Ghana who suffered from an eye condition called pterygium. And this is an eye condition that can only be resolved by operation. Now, I showed you one of the properties of stem cells, and that is clearing of dead cells or replacing dead cells. And miraculously, without surgery, this man now has a clear eye without surgery. So these are some of the testimonies we've shared so far, and I want to thank Dr. Maha for this opportunity. I will end here later on Tuesday or Friday when I have the opportunity. I'll share more testimonies. My presentation is over. God bless us all. Victory Namake, Victory.
Like I do said, when I was in Asia some 2-3 years ago, some scientists came from Malaysia and they told us that stem cell therapy is the medicine of the future. But now we know that it is not a matter of future, because 3 years ago, nobody knew that the whole world would go into pandemic. But now we are in it and everybody is running scatter for solution. But thank God we have the solution in our hands. What is happening all over the world now is the fact that people are now arguing, shall we take the vaccines or not? We have seen some countries that has banned the use of the vaccines. In Africa here, we are taking the vaccines. But the issue is people are looking for viable alternatives. Do we have viable alternatives? The answer is yes in STC 30. But before then, it is important for us to understand the full concept of stem cell therapy. What is stem cell therapy? A particular popular medical dictionary called Merriam-Webster Dictionary defined stem cell therapy as an unspecified cell that gives rise to differentiated cells. They call it hematopoietic cells in bone marrow. The meaning of that will mean that even in bone marrow transplantation, stem cell could be a very good breakthrough for everyone. Where do we need bone marrow transplantation? People who are down with sickle cell anemia. Sickle cell anemia is very, very rampant in the tropics, especially in developing countries such as Nigeria, our country here. There are a lot of issues with sickle cell there. People are thinking that the only solution probably is to go for this bone replacement surgery, which could be very, very expensive. But then, if we embrace stem cell therapy, that could be a very big breakthrough. So says that has been established there by this dictionary. So another textbook or another school of thought defines stem cell therapy as the origin of biological life. We all know that life starts from the cells during copulation. If there is a fertilization, the zygote will come together and form what we call blastocyst, which will be subdividing into various forms. You know, in microorganisms or in some low animals, we have what we call binary fusion. But you see, in living things, we have what we call blastocyst, in which the cells will be dividing from 2 to 4 to 8 and etc. before the thing will form a particular tissue, and tissue will form organ, and the organ will now form what is called body. That is the origin of stem cells, meaning that the thing could go into the beginning of life to be able to effect correction wherever necessary. So, like I said, this is a technology in which a person's own cells, e.g., neuronal stem cells, are triggered to revert to their primitive embryonic form, then differentiate into mature cells of various organs. That is the meaning of stem cell therapy. Why are we saying this? We don't want to underestimate the power of our audience. Some of them could be medically inclined, you know. So, and I've said it repeatedly, that you should not underestimate the power of your listeners or the people you are going to meet in the field while you are sharing this with them. You know, let them know why they need it. The difference, of course, is that stem cell therapy on its own is a new concept in the world of medicine. So a lot of people are trying to come into terms with it. Syllabus and curriculum. Stem cell is not yet there, you know. So this will be an opportunity for pharmacists and doctors to be able to embrace this and maybe form a career out of it. So this is very, very important. We have what we call stem cell transplantation. You know, that one is also in the vogue in medicine today. And that is bone marrow transplantation, which I talked about the other time. The administration of primitive hematopoietic cells to a patient whose native red blood cells or white blood cells platelets were either destroyed by chemotherapy or functionally defective to assist recovery. We are talking about this in the case of people who are having issues with cancer. We all know in the world today, the conventional remedy for ulcer is chemotherapy. But what is the effect of chemotherapy? Those of us who are already in the knowing, chemotherapy could actually, in the process of destroying the cancer cells, will also destroy useful nutrients in the soft tissue, thereby altering the nature of that patient in terms of falling hair. Alopecia will be very, very rampant. In other words, the hair will be falling off. The patient's eye will be sucking. Then the person will lose considerable weight. There will be a total change in that person as far as his makeup is concerned. So the immunity itself is seriously compromised. A lot of electrolytes are also lost. The soft tissue is seriously dealt with, you know. But in stem cell therapy, what it can do is that those cells, those free radicals will be obviated. In other words, those free radicals will be dealt with. The antioxidant will increase sporadically because these are new cells. And this is also applicable in managing sickle cell anemia. In sickle cell anemia, what happens is that the red blood cell is sickled in such a way that it is unable to carry the necessary oxygen to all the area that needs them in vital organs in the body, the brain, the visceral organs, and all these things. That's why you see the patient coming down with serious pain at all times, because the cell is sickled and it's not allowing blood flow. The capillary is blocked. So stem cell therapy can really do a lot of difference in this by allowing the body to produce the healthy cells. When healthy cells are generated, a lot of things can happen. One of the things that will happen first is that crisis will be banished. The patient will not be having crisis. That's one. Two, it is capable of preparing the cells to be able to have a healthy cells, which will mean that the genotype will be affected. It is possible that the genotype will undergo some rejuvenation, changing the status of that genotype from SS to AS in some cases, or even to AA. You know, this is science, and this is a breakthrough for those of us who are in this business. So that will be a good news for a lot of Africans who are watching this program as we speak. We hold it a duty to really educate our numerous and distributors on the importance of stem cells so that they can know what they are doing, and when they are in the field, they can be able to face some medical personnel. Because a lot of medical personnel as we speak are still doubting Thomases. Many of them are still sitting on the wall, on the fence. They don't believe anything good can come from complementary medicine. But then the pandemic has shown us that we cannot depend only on orthodox forms of medication. We need alternatives, viable alternatives. And what is that viable alternatives? STC 30. I am going to dwell on STC 30 very soon. But then, for starters, people who are undergoing stem cell transplantation are doing this, especially people who are having leukemia. Leukemia is the cancer of the blood. STC 30 has a lot of things to do with that. I'm coming to that. Myeloma, lymphoma, aplastic anemia, sickle cell anemia. I've talked about that, and so on and so forth. So now we want to now center on the STC 30 as a remedy. I don't like calling it drug. STC 30 is not drug, mind you. We are not distributing drugs. We are distributing natural health remedy from Superlife. So, because what does drug therapy does to the body? The drug therapy will only alleviate the symptoms, but it's not going to cure the original cause of that problem, you know. So, and that is why today, in medical practice, they will tell you certain ailments cannot be cured. You know those ailments, aren't you? Some of those ailments will include high blood pressure, diabetes, which is ravaging the entire world, cancer, stroke, another form of degenerative diseases. You know, all these cannot be easily tackled with drugs, you know, because drug, from the way it is, the definition of drug according to pharmacists is anything or a chemical that can alter a biological change in living things. It will alter it, but then it's going to leave some residues at the end of it. These are what causes what we call side effects in medicine. Side effects could be mild and it could be horrendous in some situations, you know. So we want to avoid all this. We want to avoid all this side effect, which will not be very, very good at all. So STC 30 is an all-rounder stem cell product. When we say an all-rounder, it means it can tackle wide variety of ailments, which are hitherto termed uncurable by Western forms of medication. They also say that it's a product ahead of its time because it deals with different ailments at the cellular level. So when you see product that can act at the cellular level, you can know that that medicine could cure somebody holistically. The meaning of that, of course, is that it's going to uproot the cause of that problem. It's going to renew, it's going to regenerate, it's going to rejig the entire component of well-being. That should be a good news to people who are hoping for a better change in the Medicare delivery system, you know. And these are things we are saying that in medicine, never say never. Don't say a particular ailment is uncurable. Number one, we are not gods. So when doctors say certain ailments cannot be cured, we just look at them as people who may know next to nothing. We are not gods. And every day, series of research are going on here and there. A lot of new discoveries are happening in medicine. Some of them is the STC30, which has been the discovery of the decade. So STC30 is a Swiss product based on plant stem cells combined with powerful antioxidants. It helps to reduce cellular oxidative damage, support cellular antioxidants, support healthy immune functions, and nourish your skin from within. So that should be a good news also to people who are suffering from skin cancer, which in medical terms it is called Kaposi sarcoma. When you have Kaposi sarcoma, it's a very deadly disease and it has killed thousands of people, especially in this country, in black African countries, in the tropical regions. So Kaposi sarcoma has no cure in Western medicine. The only remedy is the only remedy for cancer, like I said, is to go through radiotherapy and all these things, which may not really help. So now, let us now look at the benefit of STC30. This is STC30. So I'm sure all of us have it. Have you, as a distributor, studied the drawings, the artistic impression in front of the pack? Have you taken your time to study what are those fruits that are displayed in the front? You know, what are those fruits? Have you taken your time to study those fruits? I know some of those fruits are very familiar, especially the grapes, the cherry, and some of them that are very, very useful. For your information, we have blackcurrant juice powder there. That's what gives it that very lovely sweet taste, which is very, very good. We have vitamin C. Vitamin C, the importance of vitamin C in nutrition cannot be overemphasized. Is it in the formation of new cells you want to talk about? Is it in the area of making your bones very strong? Is it what you want to talk about? And some other biochemical processes in the body. Most of these biochemical processes in the body cannot go on very well without the equal amount of vitamin C. Bilberry extract is also there. We have glycodine there. We have cantaloupe extract there. You have seen the fruit painted in yellow there. That is cantaloupe. You have seen it there. And of course, we have some phytocells. We have Malus domestica. I'm sure that Malus domestica should be a product of Malaysia, if I'm not wrong, you know. And of course, we have fighter cells there. Then we have grape stem cell extract. You've seen a lot of grape fruits being displayed here, isn't it? So that shows you how good the kind of research that has gone into this. Now, okay, so having said that, what are some of the benefits of STC10 in managing so many critical ailments? Eyes and joint diseases. We have a lot of people are suffering from eye-related disorders all over the world today. Look at me, I'm using glasses. Well, I might be using my own glasses for the purpose of this program, or I may be using it for reading, but I can assure you that if I continue to take my STC30 very well, very soon the issue of using glasses will be a thing of the past. And that brings us to the question, you as a distributor, are you using this product? Because you are the best salesman for your product. If you are not taking that product, or you are suffering from a particular ailment, you may be a bad market for that product. So it is pertinent for all of us to make sure we use the product. Yes, we can say that, well, it's on the high side, but then when you use it and your listener or your audience discover that you are healthy looking, it means you are a very good rep of that particular product you are talking about. So joint diseases, a lot of people are suffering from joint diseases. What are joint diseases? We are talking of arthritis, which is very, very common in the tropical region. And even in the temperate region, there are a lot of people who are suffering from joint-related diseases there, which will be a precursor to, or let me say, obesity and all these things. When your joints are gliding each other, there will be what we call the usual wear and tear. So when the joints are wearing and tearing, what are the provisions made to compensate for that loss? Of course, stem cell therapy could be what it is. Because at the end of the day, when these joints are badly disjointed, you may need a replacement therapy. You will need to visit an orthopedic surgeon who will have to open it up to replace certain things. But when you are in stem cell therapy, the bones will regrow again, you know. So that's why they say it regenerates. That's the meaning of that word, it regenerates. What about stress? People are stressed up today because of the economic situation all over the world. So this could be a very powerful anti-stress therapy or anti-stress mechanism, you know. Infertility is very common all over the world today. But I tell you what, science has shown that majority of infertility are caused by infection. Infection. And the news we got from Geneva some 4 years ago was a very shocking news that we were told by the WHO that three infections has now defied the use of antibiotics. What are those three infections? Salmonella, E. coli, and Staphylococcus. Yes, these three infections have defied all forms of antibiotics. And the American government or scientists, they spent millions of dollars to unravel this mystery, to produce a viable antibiotics for these three infections. To no avail. The American now decided to call these three infections, they call them the three mega bugs, because they were unable to solve the problem. But fortunately, at that gathering, the Chinese got up and claimed that they have been using their Chinese traditional medicine to fight this scourge. India got up, they said they have been using Ayurveda medicine to solve the problem. So the WHO now directed all the member countries to go back to their folklore medicine. So, and we're happy to announce here that SCC30 has been found to be able to obviate infections. How? By simply decapacitating all these bacteria and get them flushed out. When the antibody increases, infection will have little or no chance. And that is what STC30 is doing. Because of the oxidative process, and because of the ability to boost the immunity by 100%, because a new cells will take over immediately from those cells that are destroyed. What the antibiotics could do is to repair the cells. You cannot compare a cell that is repaired with a brand new cell. The components will be different, you know. So, and that is what STC30 has been able to do. What about in spinal cord injury? What happens in spinal cord injury? The three components, the three layers of spinal cord, which are called the meninges, are dealt with. The meninges has three layers. What are those three layers? The dual, the arachnoid, and pia. Those are the three components of spinal cord. They just look like your regular toothpaste, carefully arranged on top of one another. So when there is a disengagement, it will take years before that thing can grow back. But when you are on stem cell therapy, this thing can be achieved. The cells can grow back, you know. So there's no need for those complicated surgeries. Even experience has shown that in some surgeries, more harm are caused, more irreparable damage are caused, especially when a particular nerve is tampered with. In Western medicine, this is irreversible. You cannot reverse it. But stem cell can do that, you know. So aren't we fortunate to find ourselves in this wonderful family? And of course, kidney diseases. There are a lot of people suffering from kidney-related issues, even though some of these things are caused by poor nutrition, poor dieting, and bad lifestyles, you know. And religion also causes some of this problem. In some countries of the world, they will say they don't take beer, we take soft drinks, we take carbonated drinks. Excess of carbonated drinks can also cause damage to our kidney. A 35 cl of carbonated drinks has 9 cubes of sugar. Can you beat that? When you keep taking that, and some people can take 3 or 4 in a day, and you want to have healthy kidney, the answer is no. Not to talk of the risk of diabetes, you know. So these are some of the issues. So STC30 can help you to build the damage in the glomerulus and in the filters, you know, so that those of us who are having issues with nephritis, nephritis is the inflammation of the nephrons, you know, this can be taken care of by carefully building the damaged nephrons, regenerating them, and bringing them back to life. What of diabetes? Diabetes is the inability of the body to use sugar properly. Poor metabolism of sugar is called diabetes, and it's a big cause all over the world. A lot of people are suffering from diabetes with its serious consequences. Retinopathy is there, neuropathy is there. You know, a lot of people have gone blind because of diabetes. Many legs are being amputated on daily basis because of diabetes. So what is the solution? The solution, of course, is STC30. You know, if you continuously use STC30 every day, it will allow your body to use sugar properly, provided your own cause of diabetes is not congenital. Congenital in the sense that, assuming you are born without a pancreas, it happened, or your pancreas is dead. You know, how do you want to do that? Or your own diabetes is from the brain, which is called diabetes insipidus. You know, so these are things that can be handled with the STC30. You know, what about stroke or CVA, cerebrovascular accident? You know, what STC30 build the ruptured? This is not possible. You know, but those parts of the body that are hitherto not working properly. But I must say here that it is not only STC30 that will do the job. You need to get a very good physiotherapist, and of course, you need to incorporate acupuncture too, you know, for you to get a very good holistic approach. That is very, very important. Of course, cancer is also there. Cancer is ravaging the entire world. And I don't want to take your time by naming all sorts of cancer. You know them. The one in the skin, I just talked about it, which is called Kaposi sarcoma, which is on the skin. You have the colon cancer is there. Breast cancer is very rampant. So many breasts are being severed every day on the surgeon's table, you know. So some of these things can be handled if you are able to build the cells from foundation. That is talking about using STC30. STC30 also improves blood flow. That is cardio. What do you do with this when your heart is not functioning very well? You've got to use STC30 to fortify it, to make sure that those cells are rebuilt from the foundation. That is what STC cell does. Because many of us don't really know how does it work. It will build the cell from the foundation. And of course, prostate tissue. Prostate tissue is also one of the problems that is affecting everybody now. What is prostate tissue? Some of us are having issues with prostatitis. Is it benign, or is it has it been one that is there that has been worrying you for a very long time? You know, and these are things people use surgery for. Have people seen a situation where somebody went for laser surgery for prostatitis or for prostate issues, and that thing was not, the problem was not solved? So these are problems that can be resolved with STC30. What of burns? Is it second degree burn, or which of them, or third degree burn? When you're having burns in your skin, you need to use STC30. You know, what is the usage of this? The STC30 will help you build the dermis and the epidermis of the skin. You know, when the skin is rebuilt, your body can transform and have a new cells of cells, the myelin and all the necessary components that will give your skin its original color could be reactivated using the STC30. HIV/AIDS, yeah, this is very, very controversial. A lot of people said HIV/AIDS cannot be cured. Do you belong to that school of thought? I'm sorry to shock you. STC30 is up to the task. How? The way that is going to be possible is that when you want to use STC30, It's not as if you will not still use your antiretroviral therapy. Yes, the antiretroviral therapy will serve as a ladder for STC30 to get and take care of the virus and incapacitate the virus. And all the damage that has been caused by the virus could be regenerated using the STC30. You know, what if you're having dental problems? We all know that in most cases, our teeth is more of calcium, especially the enamel. The enamel is more of calcium. So, and we know that STC30 has a lot of vitamin C supply, you know, so that when you're having issues with your teeth, is it gingivitis or dental caries or which of them have you, or you have hole in your teeth? STC30 can help you to build new cells that can block those holes instead of extracting the teeth. We've seen a lot of people today who goes to the dentist on a yearly basis for tooth extraction. This may not be good as it can affect a lot of things. And you know, once your teeth is gone, it could not be replaced. Once you reach that age of puberty, whereby the wisdom tooth has grown, there is no way you can grow other teeth. But then STC30 can help you to maintain the existing teeth without plugging them out. What about headaches? There are 7 or 8 causes of headache. That could be stress-induced headache. That could be some as a result of malaria fever. There could be some as a result of high blood pressure. There could be some due to structural problem on the neck, which could be trauma. There could be a lot of causes of headache. There could be noise pollution, and some of them could be idiopathic in nature. So what will STC30 do? The STC30 will create a condition which is called homeostasis. When homeostasis is created, the ability of the body to function at equilibrium can be guaranteed. And in this instance, some of these problems could be dealt with. Skin infection, we have talked about it. And of course, STC10 is full of anti-age characteristics. So when you use STC30, you can be rest assured that you will be looking younger than your age. Just like you see Dr. Maha. If you know Dr. Maha's age, you will not believe it. He has been on STC30. Otumba himself, whose face is shining like that of a little baby, they've all been using STC30. These are good ambassadors. And some of the leaders of STC30, you can see them glowing. That is as a result of their usage of STC30. So what are you waiting for to use STC30? Now, I want to talk about the direction for usage. Direction for usage. How do you use STC30? Tear one sachet and place the content under the tongue. Wait until it fully dissolves. We've talked about this last week. Under the tongue, we mean the space between your tongue, the lower jaw, and the incisor in the lower jaw. That's where you are going to empty it, and then you close your mouth. You don't goggle it with water, just leave it like that. The cells, the active cells under the tongue, the papillae and all these things will do justice to that. And don't forget that the sublingual gland is located very close to this, which will produce an enzyme called ptyalin. When ptyalin is produced, ptyalin will be able to act with the STC30 and create what we call a radiation there, which the tongue will be able to produce that impulse. The impulse generated by the tongue is taken to the brain, and the brain will do justice to that, send it back through the motor path to effect some cure. So it isn't a miracle at all. It's not a miracle, but these are all medical feats that have just been developed. So that is how to use STC30, and I'm sure all of us know this. So, my dear listeners and distributors, my suggestion is that those of us who are in this business, we should make sure we are a good friend. We use that product so that we could be a good testimony to the people we are recommending the products to. And I sincerely believe that with constant training like this, some of us will be very conversant and will be able to be competent to distribute the product. The product doesn't need any high sales. The product is easy to sell, but the issue, another thing is, we pray that the pandemic goes away. When the pandemic goes away, We are going to embark on regional training. Train the trainers, that's what they call it, train the trainers. All of us will be able to gather together and we'll be able to have one-on-one interaction. We can be able to now impact knowledge in a very systemic way. And some of us could be well taught because some of them will now have access to the internet. You know, this internet has its own merit and demerits. The internet may not be friendly at times, you know, so there is nothing that is good on one-on-one contact, which I believe we are going to effect immediately after the pandemic. But for the time being, we can still speak to ourselves, we can ask questions, we can do a lot of things together. So without taking your time, let me stop here to allow for some questions. Thank you very much. Over to you, Dr. Maha.
Okay, Prof, can you answer this question? See whether I can see him.
What is the question?
The question is, can we use Western medicine and traditional medicine to combat disease? That means to fight disease.
What kind of disease?
Any disease, like he's asking any disease here to fight disease. Like now, let's focus on STC30. Can we use STC30 and Western medicine combined?
Well, I want to say the answer is yes and no.
Okay.
Number one, we want to establish a proper diagnosis. In medicine, diagnosis is very important. What is that ailment itself? Mm-hmm. When you understand the ailment and the characteristics of that ailment, what are the signs and symptoms? That is when you can now determine whether to combine. Because normally, an average doctor will tell you, don't use any medicine, use only the one we are giving you. But I always tell people that when you are using a particular medicine and you are not seeing any improvement, the next thing is to change. That is the most constant thing in life. Change to STC30 and let's see the difference. But what I'm going to say is if you are on Western medicine, the doctor has put on that medicine, initially you may be using the two together, but as time goes on, you start doing what we call spacing, systematic spacing. The one that your doctor has prescribed for you, you withdraw it a bit and see the difference, you know, and then you use more of the one that, more of STC30, because that one is going to regenerate your cell. It's going to give you permanent solution to your problem. The Western medicine will not give you permanent solution to your problem. That has been proven time and time again. You know, so that is my own take on that question.
The other question is, does absorption take place in the mouth? Where does the absorption take place? He's asking now. The question is asked.
It's under the tongue. I know that some of those of us who are scientifically inclined will argue that absorption should take place in the small intestine. But there are some exceptions. Many of us don't know that the tongue as an organ also have absorptive characteristics, you know, so it is possible. If you put your medicine under the tongue, there are, like I said last week, many homeopathic tinctures are taken sublingually. So because it has shown that the tongue has the capacity to absorb drugs, you know, but these are not drugs, mind you. These are natural remedies. So when you put them under your tongue, with the reaction of the enzymes and all these things, absorption will start taking place there. And don't forget that at the end of the treatment, you see drink lots of water. But the absorption will start from the tongue. That is very scientific.
The first hour will be covered by Dr. Siva, and Dr. Siva will be focusing Dr. Sivaneswaran Pubalasingham. That is his full name, Dr. Sivaneswaran Pubalasingham, and we fondly call him Dr. Siva. Okay, Dr. Siva is a founder and president of Malaysian Society of Lifestyle Medicine, and he is going to cover on the first hour COVID-19 and beyond. That is will be his topic. And he's also an editorial board for International Journal for Disease Reversal and Prevention. And he's also a country representative for International Council of Integrative Medicine. And he's also presented papers on lifestyle medicine internationally and also both locally. So today's topic will be COVID-19 and beyond. So ladies and gentlemen, without much ado, I'm going to introduce this person and personality. Ladies and gentlemen, I give you Dr. Siva. Dr. Siva, over to you.
Hello, everyone. Welcome to our session on COVID-19 and beyond. I'm very pleased to be with all of you here today. And I would like to thank Dr. Maha and the Dominated team for graciously inviting me to this symposium. Okay, now let me share my slides with you. So now let's talk about what we're going to learn today, all right? Or rather, what are we going to discuss today? We're going to look at, we're going to have an overview of COVID-19. we're going to talk about what causes poor immunity. Why is it that these pandemics are affecting us in the way that it is currently? We're going to talk about how we're going to boost the immune system. And I'm just going to give some link to the Superlife product. Dr. Opuri will do the products in detail. Okay. So the COVID-19, or rather we call it the novel coronavirus, is the new strain of the coronavirus. It is the coronavirus SARS-CoV-2. So when we had the SARS pandemic in 2003, so we had the CoV-1. So now this novel coronavirus is officially called COVID-19, first discovered in Wuhan in December 2019. So in a span of 6 months, this virus has spread to over 200 countries. More than 10 million people have been infected, and there have been more than 500,000 people who have died as a result of this infection. So this virus, one of the issues with COVID-19 is that it has a long incubation period. It has an incubation period of 2 weeks. So for example, if I have been exposed to the virus and let's say I've picked up the COVID-19, and in that 2 weeks or before my symptoms appear, all right, I would have met a whole host of people, and this facilitates the transmission. It's spread via droplets, and some of the symptoms include fever, dry cough, fatigue, and some people present late with difficulty in breathing. The issue with COVID-19 is that it can lead to pneumonia, right? We're going to talk about what pneumonia is in just a couple of seconds. Now, it's very important to understand that older adults and people with chronic conditions, for example, diabetes, obesity, heart disease, they all have an increased risk of severity and mortality. Now, it is not only in COVID-19 that this situation has presented. Even when we had SARS and we had H1N1 and we had MERS, we had a similar situation where people with diabetes, for example, obesity, heart disease, okay, they all had, if they caught the infection, they had a more serious form of the infection and they had an increased risk of mortality, right? So pneumonia basically is an infection of the lung. It can be caused by viruses or bacteria, right? And what happens is that it inflames a part of the lung called the alveoli, okay? Now, what happens when it becomes severe is that this alveoli gets filled with pus or fluid, all right? Now, if you look at this diagram, so when we breathe in, air goes in through the nose into what we call the trachea, right? Then it divides into the lung. We have what we call the bronchus, the left and the right. And then these tubes break up into smaller tubes that we call bronchioles. And they terminate in this grape-like structure that you can see on your right, called the alveoli, all right? Now, this alveoli is very important to us, this grape-like structure, because the oxygen that we take in needs to be transported to the rest of the body. So now it is transported via our bloodstream, and the gas exchange takes place in this alveoli. There's a rich network of blood vessels that envelop this alveoli, and the gas exchange takes place. So now if this alveoli gets inflamed or it gets filled with pus, all right, or fluid, all right, the gas exchange can't take place well, all right? Similarly, once the cells and the organs have done their metabolic processes, the carbon dioxide that is released needs to be expelled. So they are brought back again into this alveoli, and then it is taken up and sent out through the bronchus back to the trachea and out, right? So when a person gets COVID-19, right? So if you look at the, there are 4 pictures, I mean, or rather 4 diagrams of them. So the upper, the one right at the top, okay? The alveoli right at the top is the one that is healthy, right? Then you have an alveoli which is infected, right, with COVID-19, but this is what we call mild. So you have some spots, okay, all right, some inflammation going on and some attempt to resolve the inflammation, but there's no pus accumulation. So these are the group of people that will have a mild infection and they will recover without much problem. Then you have a moderate infection where half of the alveoli is filled with pus or fluid, right? So it is fairly serious, but you know, you're still able to breathe. Then you have the last picture there where the whole alveoli is filled with pus and fluid, okay? So here, the person who, the patient then is unable to breathe and needs to be intubated and so on and so forth, Okay, so what happens is that why the difference in response? So basically, the theory or the thinking is that the body attempts to rid itself. Whenever there's a virus or a bacteria or any foreign matter, the body mounts an immune response. It attempts to get rid of that. Okay. Now, for people who have a poor immunity, all right, it mounts a response. It's not successful. The body still mounts a response. It's not successful. Then the body goes into an overdrive. Okay. So when the body goes into an overdrive, we get what we call a cytokine storm. So that means the body is releasing all its arsenal to get rid of the virus. But in that process, okay, when it releases all this arsenal and all this arsenal gets into the alveoli along with the viruses, okay, it clogs up the alveoli. Okay, now this cytokine storm, okay, leads to what we call inflammation. So inflammation is like, as if the body is burning, it's inflamed, it's red. Okay. Now, this inflammation also predisposes clotting of the blood. Okay, so all the cells become more sticky, and the tendency to form clots becomes higher. Hence, COVID-19 or other infections such as influenza also tend to present with strokes because of this COVID storm that takes place. Okay, so COVID storm, I mean, there's basically an inflammation, but when it overdoes it, okay, so the risk of developing strokes, heart attack, cardiac arrest, or clots in the lung become higher, right? Now, in the past, say, a month and a half or so, initially it was thought that COVID-19 didn't affect children much, but in the past 6 weeks to 8 weeks, it's been noted that some children presented with something called the Kawasaki syndrome. Interestingly, the doctor who actually discovered this Kawasaki syndrome, his name was Kawasaki, and he just passed away at the age of 95 or something, maybe about 2 or 3 weeks ago. So here, what happens is that the immune system turns on the child, all right, and I think there were a couple of children who actually had a cardiac arrest. Okay. So how are we going to prevent COVID-19, maybe wave 2, or maybe other pandemics? Okay, so basically there will be 2 steps. One is the preventive measures, and of course, fundamentally, it is about the immune system. Okay, so when we're talking about preventive measures, I'm sure most of you all are well versed with it. Okay, washing hands, using a hand sanitizer, wearing a mask when you go out, and ensuring that you don't touch your face when you're outside. For example, if you're out shopping and you pick up something, don't touch your eyes, don't touch your nose, okay? And maintaining social distancing of at least 1 meter, right? Now, the next step is we need to ensure that our immune system is optimized. Obviously, in the past 20 years, this is not the first pandemic that we've seen. Now, think about it. From the year 2000 to 2020, we've seen, this is the 4th pandemic that we're seeing. Right, SARS, then we had H1N1, we had MERS, and now this is the worst, COVID-19. Now think about 1980 to the year 2000, right? There wasn't that many, or rather I can't recall any such pandemic that happened, okay? So what has gone wrong, right? Why is it that this is rampantly spreading? Obviously, one of the reasons is that we have compromised our immune system because of our lifestyle. So what is the lifestyle that we are leading that is compromising our immune system? Let's look at that first, and then let's talk about what we should do to correct this, to prepare ourselves for the second wave or other future pandemics. Okay? One is we have a very high intake of sugar or things that are sweet, right? From cereals to beverages that are sweet, okay? To sweet snacks, okay? So like, for example, I think in Nigeria, you have the puffs, and we have our sweet Indian sweets, and we have donuts, etc. Then we eat a lot of simple carbohydrates, for example, processed rice, and for example, white noodles, and we eat a lot of fried food, okay? Deep fried food, which are very oily, a lot of cheese, eat a lot of red meat, okay? Like mutton, pork, beef, and this diet It's also high in salt, and it has very little fiber. It has very little vegetables and very little fruits. Okay, so basically, the type of diet we are eating has a lot of saturated fats. So where do we get the saturated fat from? We get the saturated fat from the red meat that I talked about, from the oil that we use to fry, okay? And this saturated fat, okay, on top of compromising our immune system, also increases the risk of heart disease. Then we have something called trans fatty acids, okay? Now, the trans fatty acids came about as a result of development of margarine. See, what happened was initially all of us used to eat butter. Then along the way, the scientists said, okay, now you guys are eating a lot of butter. This is leading to heart disease. So let's change that. So they came up with margarine, which was made from vegetable oils. Now, in the process of creating this margarine, what happened was that there was some chemical shift, or rather, or a structural shift. And these trans fatty acids that were created, okay, 20 years down the road, after we've been using it for about 20 years, they said, okay, if you eat trans fatty acids, it's even worse than eating saturated fats. Your risk of dying from heart disease is even higher, all right? So now if you notice, a lot of the margarine in the market will say zero trans fatty acids or no trans fatty acids. But a lot of commercially baked products, okay, still use, a lot of people have stopped using margarine as well, but a lot of commercially baked biscuits, chips, etc., all have trans fatty acids. All right, then we have, of course, we have a lot of sugar from the sweet things that we eat. Now, if you're going to eat simple carbohydrate, it's actually sugar in another form, all right? So again, that contributes to sugar. A lot of salt in all the in the food that we're eating, fried food, either when we buy from outside or whether we ourselves put a lot of salt. Say, for example, cheese has a lot of salt in it, right? And then preservatives, flavor enhancers, coloring. Now, all this is going to lead to various types of diseases. Now, while when this COVID-19 began to spread rapidly, so countries around the world enforced some kind of restriction on movement. So various countries had various restrictions. So what happened was that though we practice social distancing when we go out, there was no social distancing between us and the refrigerator and the pantry when we work at home. So because we are free to go to the refrigerator and the pantry whenever we wish, the tendency to snack is higher than it is when we go to work, all right? Now, why is the tendency to snack higher? Because of, one is accessibility of food, okay? Second is people tend to feel a little bored, all right? You don't have your usual routine. And the third thing will be anxiety and stress. Now, COVID-19 has brought a huge amount of anxiety and stress along with it. Okay, why anxiety and stress? Firstly, is that people are unsure how this disease is going to present. So they're not sure if they will get the disease or the family members will get the disease. If someone gets the disease, do we have a specific protocol where you can recover? What are the chances of recovering? How long is the pandemic going to last? And when is the vaccine going to be out? So you see, for all the questions that I've put forth, none of us really have any specific answer. Now, our mind works in such a way that when we don't have specific answers, we find it difficult to remain in the moment. We always like to think either to the future or or we like to ruminate about the past. That's the nature of the mind. So this creates anxiety, okay, and stress. Now, as a result of COVID-19 and the shutdowns, we've had world over, there have been huge number of people, millions of people who've been laid off, companies that have closed, okay? So this is creating financial issues, right? As it creates financial issues, people don't have a job or their businesses are closed down, okay? It creates anxiety and stress. And also, just being locked in the house, many people are not able to adjust to the new norm, right? They find it restrictive and they're not able to adapt easily, okay? So that also creates some form of anxiety and stress. So when people feel anxiety or stress, what do? They eat more of the fried food, they eat more of the sweet stuff. So think about it. When you feel stressed or you feel anxious, do you just say, okay, let me go and have a healthy apple, or let me have a carrot stick as my snack? No, right? So you're going to go and look for something to munch on, like some Sprite stuff or something sweet, okay? Why? Because the hormone that's released, the stress hormone, cortisol, actually sort of promotes this taste or for sweet things and fried things. Okay. All right. Now, other things like excessive alcohol intake, all right, smoking, all right. Smokers are at an increased risk for these infections, and they have an increased risk of the severity and mortality compared to the average population. Okay. And lack of exercise. Okay. So sitting is now considered to be the new smoking. Lack of sleep, all right? Lack of sleep and stress. It could be work stress, emotional stress. And what about technology, all right? Now, technology also contributes to stress because, you know, we are continuously on the go with technology. So even when you put your phone on mute, and if you can hear the ding or the ping, okay, immediately you feel you need to reach out to the handphone. And if you don't, you'll feel a small burst of cortisol, right? Now, when you have stress going on in your body continuously, whatever the cause, maybe lack of sleep, maybe emotional stress, maybe as a result of technology, okay, this is going to compromise your immune system, okay? Now, when your immune system, whatever, all the factors that we talked about that compromises the immune system, increases the risk of chronic diseases. They all go hand in hand, okay? So basically, changing these patterns of behavior will not only help us to boost our immune system, it will also help us to reduce the risk of chronic diseases, or if we have chronic diseases, will help us to better manage them because, as I mentioned earlier, the severity and mortality is higher in people who have chronic diseases as compared to the compared to people who don't have chronic diseases. Okay, so a lifestyle that we talked about, right? Bad diet, no exercise, a lot of stress, a lot of alcohol, smoking, etc. Right? Compromises our immune system. Okay, so it compromises our immune system, increases the risk of infection. Also, if we get the infection, the recovery is going to be poorer. Now, one other thing that happens is that when we have a poor lifestyle, it also compromises our gut microbiome. I'm going to talk about what gut microbiome is later on when I talk about the SCC, all right? So the gut microbiome, which plays an important role in our immune system, also get compromised. So basically, the gut microbiome, in a nutshell, right, is we have bacteria in our gut. It should be roughly about a percentage of 70 good and 30 bad, right? Now, if we don't maintain this sort of proportion and the bad bacteria overruns the good bacteria, our immune system, our frontiers in the immune system get compromised, okay? Now, it also, of course, increases the risk of chronic disease if you have a poor lifestyle and poorly managed conditions. So hypertension, heart disease, okay, obesity, diabetes, stroke, cancer. Now, people who are obese have an increased risk of severity and mortality as people who have diabetes. So people who have diabetes, okay, so if they get COVID-19, right, their risk of dying is 3 times the average population. And they have a 2 times increased risk of having a severe form of the disease. That means, let's say, getting into ICU, right? And 12 to 16% of admissions are people who have diabetes. Okay. So the good news is actually, because we call it lifestyle diseases, right? So all these chronic diseases can be prevented, managed, or reversed. And the beauty of it is our immune system can be enhanced. Our immune system gets compromised because what we do to it. Again, it's a lifestyle-related issue. So we change our lifestyle. If we change our lifestyle, then the immune system can be enhanced. So let's talk about the 7 strategies to prevent COVID-19 and future pandemics. So what we want to do is we want to replace the negative lifestyle behaviors with positive lifestyle behaviors. So we want to eat healthy, okay? We want to have physical activity, manage our stress, sleep, have appropriate amount of sleep, okay? Avoid risky substances and maintain healthy relationships, right? So what type of food are we looking at, right? We want to select whole plant-based foods that are high in fiber and nutrient dense. We want to discard food that is nutritionally empty and calorie rich, okay? So basically, we are looking at having in a plate, okay? We should try to aim for half of our plate should be fruits and vegetables. All right. Now, quarter of our plate should be protein, and we should have more plant protein and our chicken or fish. I'm not saying you've got to become a vegetarian. It should be more like condiments, okay? And replace the simple carbohydrates with whole grains, okay? So your vegetables and fruits that you eat should be varied and they should be multicolored. Why varied and why multicolored? Because I'm sure by reading the material about Superlife product, you will realize that the various fruits and vegetables that have been used in your products have got different benefits. Okay, they have got different vitamins, different minerals, different type of antioxidants. So by doing by varying your food, you're going to get all the necessary nutrients that you require. Right now, replace your simple simple carbs with complex carbs. So, for example, oats or brown rice or quinoa, millet. Okay. And then you can have things like chapati where you're using whole wheat, brown bread, okay? And when you talk about plant proteins, it is very important to add legumes into your diet, all right? Why should you add legumes? Because legumes are high in fiber, and we're going to talk about the benefits of that shortly. Okay, so what type of legumes? Green peas, dal, red beans, okay? White peas, okay? There are many types of legumes. Then, of course, you can have the chicken or fish. Please remove the skin of the chicken because the skin has most of the fat. Okay, if you really feel that you need to eat the skin, keep it for an occasion, right? All right, now, yeah, talking about the fiber. So when we take complex carbs, we have high fiber. Vegetables, fruits have high fiber. Legumes have got high fiber as well. And legumes in particular, all right, along with this other high fibers, when they're digested by the good bacteria in our intestine, they produce something called the short chain fatty acid. And in recent times, this short chain fatty acid has been shown to help manage diseases like diabetes or prevent diseases like diabetes. So our gut health is extremely important, all right? It plays a very big role in improving our immune system and also preventing or managing other chronic diseases. Now, replace the trans fatty acid and the saturated fatty acid with, let's say, monounsaturated fatty acid like the olive oil. You can have some sunflower oil, okay? Incorporate walnuts or into your diet. Almonds. Almonds is good brain food, and you can have some oily fish, all right? And more some condiment, okay? All right, now let's talk about exercise. Now, when we talk about exercise, right, you need to break down your exercise into 3 groups, right? We need to have one aerobic exercise, right? So how much of aerobic exercise? You should do at least 210 minutes of exercise a week. So if I break that down for you, it's 40 minutes, 5 times a week, approximately, right? So that's not much, right? You can start off with even 30 minutes 3 times and work your way up to the 210 minutes. Then you need to do strengthening exercises, right? Some light weight, okay? Or you can use your body to do weights, for example, like plank, or if you do yoga, some of the yoga exercises can actually strengthening exercises as well. And you need to do flexibility exercises. It is very important to do flexibility exercises because as we age, right? Now, one of the biggest problems is that moving away from our topic about the immune system is that there's a high risk of falls. And one of the reasons why we have a high risk of fall as we age is that we become stiff, our flexibility is not there, our balance is not quite there because our stance, our stride becomes smaller, okay? So remember, so you need to exercise to boost your immune system. Exercise also makes you feel good. It releases the endorphins, okay? Now, manage your stress, okay? Emotional wellness is important, all right? So if a person has depression, this also increases the risk of heart disease, immune dysfunction, and more. So ways to manage stress include doing yoga, tai chi, all right? And listening to music, okay? So do some stress management techniques and reduce the intake of alcohol. So what is sort of permitted or said to be okay to be taken is 2 drinks per day for men and 1 for women, right? So which means it's 14 and 12. But it's important to note that this must be taken daily if you want to take. I mean, what I mean is that you can't accumulate it and say, hey, doc, I haven't had a drink in 5 days. It's Friday today, so I've got 10. So I can maybe take 6 to 8. Okay, so no binge drinking. Binge drinking negates the benefit of, a small benefit of taking alcohol. Now let's talk about smoking, right? Now smoking, right, compromises your immune system, of course, increases the risk of lung infection. We all know it increases the risk of lung cancer. But smoking also is a big risk factor for cardiovascular disease and clots forming in your legs, okay? So if let's say research shows that if today, 28th of June, you decide, okay, I'm going to stop smoking. Now, 1 year down the road, so 28th June 2021, you would have reduced your risk of getting heart disease by 50% just by doing this, just by stopping the smoking practice, okay, with no other change. So that shows how big a contributory factor smoking is to heart disease as well, right? Now, when we talk about sleep, right, there are two parts to sleep. One is the amount of hours, and two is the timing of your sleep. Okay, so of course, I think we all know basically we need roughly about 6 to 8 hours of sleep, good quality sleep, right? If you don't sleep enough, what basically happens is that you are actually putting your body under stress. So if you experience stress, you will have a strained immune system, right? So you need to sleep to optimize the immune system's function. Now, some people sleep at 2 or 3 o'clock in the morning, and then they get up at 10 o'clock, all right, or 6 o'clock, or 9 o'clock, something like that. Now, what happens is that when you have a shift in your sleeping pattern, right, you are disturbing the body's biorhythm. So the body is programmed 10, 11 o'clock at night. It has some repair function. It begins to release growth hormone, and all these processes are completed by 2 or 3 in the morning. So now, if you don't sleep at that time, then your body is not able to do what it needs to do. Okay, so it's very important to sleep at the right time. Okay, now we talk about relationship, right? Now, being socially connected to people, right, means you need to be connected in person, not just connected technologically, right? Not just chatting on the phone, right? Now, there was a study done in Harvard, and they compared Harvard male students with inner city Boston guys. So what they were comparing was these very privileged guys from Harvard students, with these inner city Boston guys who had nothing. So they followed them up for 75 years. And they wanted to look at what was the key predictor of happiness and longevity. And they found that social connectivity was the most important predictor of happiness and longevity. So it was not their education, not their successes, not how much money they had. Okay. Now, why I keep talking about this technology is basically the relationship between us and technology is if we are masters of technology, okay, then this works well for us. Just like how you guys are all doing international business by using technology. But if we are subservient to technology, all right, now this is going to cause a lot of problems and issues. Now, there was one professor called Adam Adler. He was from New York University's School of Business. And he wrote this book, Irresistible, right? Just to show you how dependent we are on our handphones. So he did a survey and he asked them, would you rather break you had a situation where you had to choose, would you break your bone or would you break the handphone? And so 46% without any hesitation said they would rather break the handphone. Sorry, they would rather break the bone. Okay, they wanted their handphone. They would rather break their bone. And the other 54%, it was like it was a big decision. They had to really think it through. Okay, what would I do? Should I break my bone or my handphone? What am I going to do? All right. So so there's something for us to think about. Okay. All right. So let's talk a little bit. I'm just going to give a quick overview, and actually I'm just going to link it to lifestyle, and Dr. Opuri will do the detailed discussion on Superlife's health products. So I told you there are 7 steps to preventing let's say the second wave, preventing ourselves from getting COVID-19 or preventing future pandemics. So we've talked about the six: diet, exercise, stress management, sleep, avoiding reducing the intake of alcohol, no smoking, and social connectivity. All right, now all this helps to boost your immune system and reduce the risk of getting other diseases. Now, the seventh in this this package is your Superlife health product. All right. So, what are we looking for when we're talking about Superlife health product? Is we want a product that helps to boost our immune system, enhance our gut microbiome, reduce the inflammation, so that we are not going to succumb to a cytokine storm, strengthen the respiratory and the immune system. Okay. So, starting with Superlife Colon Care, all right, which supports the digestive tract. Okay, so it has many fruits and vegetables that have been incorporated into this product, all right, and they have soluble fiber, insoluble fiber, beetroot, nutrisil, aloe vera, chlorophyll, amla, and friendly bacteria, and others. All right. So now, when we look at our organs of detoxification, they are colon, liver, right? We have our kidney, lymphatic system, lungs, and the skin. Of all these, the most important detoxification organ is our colon, right? Now, the large and small intestines are almost 25 feet long. So the total surface area of this intestine is almost like a tennis court, okay? So this, colon and intestine, they can store a large amount of partially digested putrefying matter and chemicals. Okay, so if we eat a diet that is poor, right, which is low in fiber. So if you look at the diagram and you look at the upper diagram, so now assuming today is Saturday, right? So we only have Wednesday's meal being evacuated or in the process of being evacuated. So we are still holding Thursday, we are holding Friday, we are holding Saturday, right? So we have 3 days of meals still with us, and we're only evacuating Wednesday. So if you're going to have 3 days meals in the intestine, they're going to decay, they're going to putrefy, right? They are going to distort our gut microbiome as well, right? It's going to facilitate the growth of the bad bacteria. Now, if we eat a high fiber diet, now this is Saturday's meal is here, right? And Friday's meal is being evacuated, so which is not bad. So that means today is Saturday, Friday's meal is being evacuated. So it's very important to ensure that our gut, the transit time, okay, it's good. All right, transit time of our intestine must be good. Okay, so let's talk about the gut microbiome. Right now, the human body plays host to not 1 million or 2 million, 100 trillion microorganisms that live together with us. So we and these microorganisms have a symbiotic relationship. So I take care of you and you take care of me. So we live quite happily, right? So long as the balance is right, okay? So they play an important role in human health. They also play an important role in disease, okay? It depends on how the balance is, whether we have more of the good or more of the bad, okay? So this gut microbiota is considered now as an essential organ, and they have found, researchers have found there are 150 times more genes than the entire human genome, okay? So the digestive tract is where bacteria meets the immune system, okay? So our large portion of our immune system is in our intestine. It's our first line of defense. So if you look at your diagram, if you look at the diagram on the right, okay? So the gut microbiome and the immune system in the intestine, there's an interplay, right? It helps to balance the immune system, right? So now if the immune system is tipped, whereby we have low immunity, and so then you have this low immunity, it's difficult to protect ourselves, and then we have an overstimulation of the immune system, for example, like in COVID-19. Now, this gut microbiome, other than playing a role in our immune system, also plays a role in managing diabetes, obesity, and many other diseases, okay? Now, in a research that has been published online and will be published in paper in August this year, right? They looked at gut microbiota and COVID-19, okay? Now, what the researchers say is what we know. The role of the gut microbiota in lung disease has been well established, and diet, environmental factors, etc., play a role in how our gut microbiome is going to be. Right now, if we have a healthy gut microbiome, we have good immunity. If we have a poor gut microbiome, then we have poor immunity. Right. So what they found was that the gut microbiota, we all know that in COVID-19, the elderly are very susceptible to the infection, and mortality is extremely high in the elderly. All right. What they found was the different types of gut microbiome is decreased in old age. Okay. And so the researchers concluded that enhancing our gut microbiome will play a significant role in improving our immune system. Okay. All right. So if we look at the components of Superlife Colon Care, they are very good. They help to detoxify the tract. They also detoxify the liver, right? For example, beetroot and milk thistle, it helps with detoxifying the liver, and also milk thistle helps with regeneration of liver cells. Okay, things like substances like aloe vera and chlorophyll help to reduce inflammation, repair leaky gut, along with the astaxanthin. Okay, you have amla and others to inhibit yeast proliferation, and they are also antimicrobial, and they provide the nutrition for the gut bacteria, prebiotic, and also this product comes supplemented with the friendly bacteria. All right. Now, if let's say someone goes to the shop and just buys friendly bacteria, okay, but you have a very unhealthy gut, okay, so you have a gut where transit time is very long, right? That means 2 days, 3 days, you don't go to the toilet, okay? And then obviously a gut like that is going to be inflamed. It's going to probably have leaky gut, and there's going to be a lot of yeast, candida in that gut. So then supplementing just with friendly bacteria is not going to significantly help them, right? So a composition like this, where it takes care of from step one right until it's supplemented with friendly bacteria, will play a big role in helping you maintain a good digestive health, which will help with your gut microbiome. So the benefit here will be, this will help to enhance your gut microbiome, then it will boost your immune system, and it will increase the production of short-chain fatty acids. So the components in the product, okay, right, will feed the good bacteria, and it will help to and it will help to produce short-chain fatty acids, and this helps to manage chronic diseases as well, because they are all interlinked. So, like I told you earlier, a communicable disease, that means an infectious disease in a chronic disease setting is very explosive. Okay, so this will help to manage or prevent chronic diseases. So it keeps us better equipped to deal with pandemics or infections that come along our way. Okay, now if we look at Superlife Total Care, again, there are many different fruits, and there's added on to this product, right? From cantaloupe to blackcurrant and bilberry, and you have your stem cells from the apples and grapes. So very importantly, this product has superoxide dismutase, which is encased with gliadin, all right? So to prevent gastric destruction, and you are able to bypass the gastric destruction. Now, superoxide dismutase is very important because it helps to neutralize or disarm the free radicals. Okay, so it has a very powerful anti-inflammatory action, and along with your gamma-linolenic acid, which is found in the blackcurrant, and anthocyanins, right? So this product is a very powerful anti-inflammatory product, right? So this anti-inflammatory action of the product helps to prevent damage to tissue. So this product helps to control cellular inflammation. Also, it is excellent to prevent development of blood clots and increases cellular rejuvenation, repair, and healing. So people who, let's say, have had COVID-19, right? Now, there is a lot of discussion that there may be some long-term sequelae if a person has suffered COVID-19. So it will be very important for them to take something that helps with cellular rejuvenation, repair, and healing, and keep the inflammation at bay. Okay. Then you have Then you have your Superlife Immune Care, right? So Superlife Immune Care has your AFA, sorry, okay, that's your AFA, mixed berries, moringa, the medical tree, guarana, and more, okay? So now here, one of the important components that are brought to you by some of the components in the product by AFA and the mixed berries are something called polysaccharides. So polysaccharides are powerful immune stimulants. And not only are they powerful immune stimulants, they are also immunomodulatory. Immunomodulatory means when the body needs the immune response to be mounted, it mounts that immune response. And when it needs it to be toned down and act as an anti-inflammatory compound, it's able to do so. Same with this product also has moringa, which also has the ability to do that. Okay. Now, the mixed berries have also shown to have antiviral activities. And so again, in another research where they looked at berries as potential anti-influenza factor, of course, it's not COVID, but basically it's another type of virus. And they found that, okay, the berries basically acted in two ways. One is that it basically acted directly on the virus, okay, to prevent it from replicating. And of course, the other thing it did was it stimulated the immune system. Okay, so it acted directly on the virus, prevented the replication, and then it also helped boost the immune system, right? So this product, okay, enhances the immune system, all right? The components there help support the vascular system, regulates the blood, has good ability to regulate blood glucose because the mixed berries have got high fiber. It has guarana, which also will play a role in managing weight. Okay. So what are the lessons that we have learned from COVID-19, okay, to prepare ourselves for the second wave and future pandemic? First and foremost is that we must maintain a lifestyle that enhances the immune system. So like I said earlier, a lifestyle that enhances the immune system is the same lifestyle that will decrease the risk of chronic disease. It will decrease the risk of getting diabetes, heart disease, hypertension, and more, okay? We need to have good digestive health and maintain a healthy gut microbiome. So because a healthy gut microbiome is going to help to enhance the immune system, is going to be protective. It's our first line of protection, right? It is very important to make sure that we don't get any of the non-communicable diseases, any of the chronic diseases, okay? And it's also important to prevent obesity, right? So in conclusion, ladies and gentlemen, a healthy lifestyle that includes healthy diet, exercise, emotional wellness, adequate sleep, social connectivity, and avoidance of smoking, along with Superlife products like Superlife Colon Care, Superlife Total Care, and Superlife Immune Care will keep your immune system optimized. It will help to prevent inflammation and promote regeneration, repair, and healing to combat COVID-19. Stay safe and stay healthy. Thank you.